Good afternoon. Thank you very much for inviting me to present at the iCON conference. My name is Dr. Rajiv Reebye, and I'm a physical medicine and rehabilitation specialist practicing in Vancouver and New Westminster, British Columbia. My objectives today are to discuss what are the effects of a stroke on your body, to discuss the realities of stroke recovery, and also discuss what is post-stroke rehabilitation and how can rehabilitation help me after a stroke and my transition from hospital to home, as well as to discuss the importance of exercise after a stroke. Stroke is the third leading cause of death in Canada and the second leading cause globally. Over 400,000 patients live with stroke-related disability in Canada. Of 100 patients hospitalized for strokes, 15 will die before leaving the hospital, and approximately 10% will recover completely, 25% will have minor disability, and 40% will have moderate to severe disability. As well, 10% will need long-term care. The annual cost of stroke is approximately $3.6 billion, taking into account both healthcare costs and lost economic output. The human cost of stroke on families and communities is huge. So how can a stroke affect my body? While the effects of stroke are different for each person, each patient is unique. The effects post-stroke can be mild, moderate, or severe, and dependent on factors such as the type of stroke, being ischemic like a clot, or hemorrhagic, a bleed, and side of the brain where the stroke occurred, the right hemisphere or the left hemisphere. The size and location of the damaged area because of the stroke can also lead to different functional changes, as shown in this diagram. It could affect functions such as spoken language, scientific functions, written language. There's a left hemisphere, right hemisphere, spatial orientation, hearing, for example, reading. But stroke severity can also be affected by the amount of time the brain area had no blood flow to the time it took to get to the hospital to receive treatment, and if the brain was affected from a prior stroke. Depending on the size and location of the damage from the stroke, this can lead to mild, moderate, or severe deficits involving cognitive or physical symptoms, including problems with communication, such as difficulty expressing, understanding, and speaking, cognitive, including difficulty with memory, fatigue, as well as difficulty controlling emotions, for example, low mood, depression. And depression is common post-stroke, affecting approximately 20 to 25% of post-stroke survivors within 2 years. Physical symptoms such as mobility, hearing, sensory, as well as stiffness from spasticity, as well as difficulty with sensation, feeling, and visual changes, and sometimes bowel and bladder problems can occur after a stroke. We can see changes that are purely physical to purely cognitive and all combinations in between. The effects of a stroke are dependent on size and location, and this is the English slide. Now let's discuss the reality of stroke recovery. Recovery is dependent on type and size of the stroke and patient's pre-stroke and current medical, physical, cognitive status, and age, for example. Recovery can occur through brain plasticity. This is the ability of the brain to change and adapt over time, and this aids in recovery of function as remaining neurons make new connections, and other parts of the brain can take over lost functions. Now, this is a natural process that can occur spontaneously. For a stroke survivor, there may be many reactions that they may feel, such as social isolation, grieving, including anger, irritability, depression, disbelief, fear, anxiety, as well as difficulty adapting to physical, cognitive, and emotional changes. These reactions to stroke can also be experienced by their families and caregivers and providers and can lead to caregiver burnout. So why is post-stroke rehabilitation important? Well, it can improve functional abilities, it can enhance physical, cognitive, emotional, and also decrease caregiver burnout. It can improve quality of life. It can focus more on maximizing abilities and not on the term disability. Rehabilitation is an integral part of disease management, and it can also help decrease modifiable stroke risk factors, such as decreasing high blood pressure, improving diabetes control, and can help improve functional goals. Now, rehabilitation can help in stroke recovery, and it is a long-term process. The length of time varies from one person to the next. Recovery can take several months to years, and a patient may not reach their pre-stroke status. And the goal is, however, to maximize the current abilities. Progress can continue to happen over a long period of time. Some patients, however, may not recover post-stroke. I really like this diagram from the 2009 Canadian Stroke Best Practice Rehabilitation Guidelines, highlighting the stroke continuum of care. Rehabilitation is shown on this continuum of care to maintain or improve current functional abilities and or decrease caregiver burnout. It can start from awareness with primary prevention strategies to secondary prevention and to stroke recovery. It can also seamlessly and fluidly adapt from acute stroke care to end-of-life stroke care. There's high-level evidence as shown in the Canadian Stroke Guidelines 2019, stating that all patients admitted to hospital with an acute stroke should have an initial assessment conducted by a rehabilitation professional team as soon as possible. This core rehabilitation team members should comprise a physician, occupational therapist, physiotherapist, speech-language therapist, nurse, social worker, dietitian, and the patient and family are also included as part of this core team. Collaboration is key in the success for optimal delivery of rehabilitation services. And here's the English translation slide. Now, this slide shows the importance of goal setting and working as a team to enhance patient care. The patient is central to this process, and it takes a team to help with the rehabilitation journey. We have to respect and work with the patient's goals, such as improving bed-to-chair transfers, swallowing, speaking in the acute post-stroke phase. But goals also have to be achievable and realistic, and the rehabilitation team works closely with the patient and their caregivers to achieve such goals. Now, again, the Canadian Stroke Best Practice recommendations also show that patients having had a stroke can benefit from ongoing rehabilitation goals, and they should continue to have access to specialized stroke services after leaving the hospital. This should include a facility-based outpatient services and or in-home rehabilitation services. So we'll talk more about this now. So when are you ready for rehabilitation, both inpatient and outpatient? Let's talk about inpatient rehabilitation. Readiness is based on many factors, but the concept of rehabilitation, for example, with stretching, early patient positioning, improving hand-leg function, assessment of swallowing, starts once admitted on an acute ward. Inpatient rehabilitation is required for some patients with moderate to severe disability. Once a patient is medically stable, post-acute stroke, as well, they need to have certain parameters, such as ability to sit unsupported greater than or equal to 1 hour per day. They require greater than or equal to 2 disciplines, for example, physiotherapy and occupational therapy, and are able to tolerate greater than or equal to 3 hours therapy per day, or greater than or equal to 5 days per week therapy. Now, when we're delivering rehabilitation programs, it is important to set realistic goals. And this is important when patients undergo rehabilitation. Working closely with the medical team, rehabilitation team, and family members is key. And during the rehabilitation process, patients will receive help with physical abilities, such as hand stretching, grasp exercises, and to improve cognitive abilities, such as memory and thinking, improve their communication, and also improve their emotional issues. Some patients may not be ready for inpatient or outpatient rehabilitation, as they may have significant cognitive and physical symptoms that may make them unable to participate. Now, how does rehabilitation work? The theory is that rehabilitation can help with motor and cognitive retraining and help with neuroplasticity. The goal of stroke rehabilitation is to help you recover as much function as to maximize your abilities, such as improving independence with activities of daily living, such as dressing, feeding, toileting, and to help with safe discharge home. Now, not all patients are able to go from acute care to home and may require an inpatient rehab unit and then transition home. And then after this, they may require outpatient rehabilitation once discharged. Unfortunately, some patients are unable to go to the inpatient or outpatient rehabilitation setting due to their significant high care needs, inability to participate because of cognitive, medical instability, and extent of their stroke. And they may require reassessment to reassess their readiness for rehabilitation. There may also be patients that may never be able to participate in a rehabilitation program because of their high level of disability from their stroke. Now let's talk about post-stroke rehabilitation exercises. The type of exercises and rehabilitation programs depend and are dependent on the severity of your stroke, the part of the brain affected, the effects of the stroke on your body, mind, and emotions, your medical stability, the ability to actively take part in your recovery, and the support system that you have from family and caregivers, and whether the goals, your goals, are achievable, realistic goals. And also, are the physician goals also realistic and equal to that of the patient goals? So it's very important to achieve and to set the realistic goals between patient and physician, and the physicians and the rehabilitation team. Now, post-stroke exercises are important to help reduce the risk of a further stroke by improving blood pressure, cholesterol, and diabetes control. Strengthening exercises can also help decrease muscle mass loss and can also help with balance and function. Stretching can help decrease spasticity, which can be seen in approximately 30% of patients post-stroke. And stretching and exercise can help improve function and decrease pain. Now, to help these changes in the brain, we need to train regularly by repeating specific exercises and activities to help with neuroplasticity. Now, exercises can be conducted in the hospital outpatient setting or in your home. You can do stretching, the muscles become stiff after a stroke. You can use strengthening exercise with elastic bands. You can also improve your walking with aid with a gait aid, for example, cane or wheelchair. And it is also interesting to do exercises such as mirror therapy, where you can reflect your good arm to help with wiring in the brain to help improve the function of the affected plegic or the limb that was affected from the stroke. We can also use technology, for example, using applications to help with cognitive and physical exercises. We can also do simple exercises with, as shown here, with a ball or Play-Doh, for example, to help with grasp and stretching of your hands post-stroke. We can also do weight training at home or in the hospital or outpatient setting. Now, there are also rehabilitation outpatient programs, such as community programs like the READY program. This stands for the Community Rehab Early Discharge Initiative, which can be found in Fraser Health in 6 Fraser Health communities. Within the READY program, they also have designed the TIME program, the Together in Movement and Exercise program. This program can help to improve mobility in the community. You need to have the ability to walk with a cane for 10 meters for this for inclusion into this program. And for more information, you can find this online in this website here. And here is a snapshot of the website. Similarly, there's a program in Vancouver, Okanagan, and Squamish called the FAME program. And FAME stands for Fitness and Mobility Exercises. It is a group exercise program initially developed for people living with stroke who have some standing and walking ability. The program was developed to fulfill the urgent need for a safe and effective exercise program to enhance mobility and fitness of people living with stroke who are generally older, less fit, and have mobility problems and are prone to falls. FAME is a group exercise program that can be easily implemented into community or hospital settings. And here's a website for the FAME program. Here's a website for the FAME program. Now you can continue with the gains from the outpatient program even in your home, such as daily slow stretching, strengthening of upper and lower limbs, cognitive games, and communicating with family members on a daily basis can help to improve speech and language functions post-stroke. It is important to be aware that exercises can be conducted even if you're not able to stand or walk, and can be adapted and conducted in a wheelchair or in a bed. A community physiotherapist can help you set up such an exercise program. The Heart and Stroke guidelines state that physical activity up to 4 to 7 days per week to add up to 150 minutes per week of 10 minutes or more should be attempted. However, the reality is that you may have to adjust or modify the intensity, frequency of such exercises based on your health status. Fatigue, stamina issues post-stroke may also affect the intensity of the exercise program. With the COVID pandemic, we have had to adjust many of our outpatient programs to virtual rehabilitation. This is a powerful tool to help with self-directed rehabilitation and also to do more rehabilitation in your home and community setting via the computer, for example. There's evidence that virtual rehabilitation interventions can be as effective as in-person rehabilitation in the right population. There's also evidence that virtual rehabilitation can work better for some types of rehab than others, for example, speech therapy and virtual physical exercises. An example of the virtual program is a GRASP program. This GRASP program is a program for people living in the community to improve arm and hand function after stroke or brain injury. This 10-week program is suitable for people who have some grasp and release ability post-stroke. So in summary, rehabilitation is not only important immediately post-stroke, but can help with reducing your risk of another stroke. Ask your physician therapist what you can do on your own to help you keeping to move forward. You should also know your abilities and limitations and maximize your abilities. You have to decide on your goals and priorities. For example, having realistic goals, goals that can change with time, and goals that can be fine-tuned. Recovery can take time, so do not get frustrated, but unfortunately for some patients, they do not recover post-stroke, and this is also a reality. And remember to balance your activity and get rest to avoid fatigue, keep track of your progress, and remember that every patient is unique and their journey is unique. And here are some important resources. These are videos created by the American Heart and Stroke Foundation. And similarly, the Canadian Best Stroke Practice, Your Stroke Journey, a guide for people living with stroke, is excellent, a resource for caregivers and stroke survivors. Thank you.